Hi, my name is Josh Molmeyer, and today I will be presenting my research analysis assignment presentation for Introduction to Sociology in the fall of December 2020. Now, my assignment is based around the study titled Prevalence of and Risk Factors for Intimate Partner Violence in China by Tu, Zhu, Ocampo, Koenig, Mock, and Campbell. This appears in the American Journal of Public Health and was published in January of 2013. And for this study, the researchers set to analyze the research question of what variables or risk factors put couples at a higher rate for intimate partner violence. According to Henslin in our textbook, an independent variable is known as a characteristic, a stimulus, or an intervention that causes a change, and in this case, the dependent variable is the measured effect. And for this study, the researchers outlined 4 independent variables, the first being the respondent's alcohol use, which in this case was all women. The partner's alcohol abuse, or use, in this case was the men. The partner's extramarital affairs, and how frequent the couples were quarreling, or fighting, or bickering. And obviously the dependent variable, it was the occurrence of intimate partner violence. With that, the researchers formulated 4 hypotheses. First being that the more alcohol the respondent consumes, the more likely they are to partake in domestic violence or be victims of domestic violence. The more alcohol one's partner consumes, the more likely they are to partake or be victims of domestic violence. Third, the partners who are partaking in extramarital affairs are more likely to partake or be victims of domestic violence. And finally, couples who frequently quarrel are more likely to partake or be victims of intimate partner violence. So going on to the methodology, the researchers in this study gathered their information through face-to-face surveys where they took place and found their participants as they all were patients going to see doctors in a gynecological clinic. They received a total of almost 9,000 information of women staying during a 3-month period. And out of those women, 600 of them were randomly selected to participate in the study. According to Mueller in a class discussion this semester, surveys are otherwise known as interviews or questions that are being asked of the participants in a non-coercive manner to where they are offered verbal responses. So following the completion of the study, the authors were able to answer 4 of their hypotheses, and in this case, all of those hypotheses were right. To start, the researchers found that as the respondent consumes alcohol, the risk of intimate partner violence was sure to increase. Also, as the partner consumes alcohol, the risk of intimate partner violence also increases. This was found to be true as well. Third, if couples have extramarital affairs or are partaking in extramarital affairs or seeing other partners, their likelihood of intimate partner violence is also found to increase. And lastly, frequent quarreling was found to lead to increased risks of intimate partner violence. So moving on, according to Henslin in the textbook and multiple class discussions by Mueller, the sociologist perspective would state that external stimuli or effects or influences are sure to manipulate or influence how someone is going to react or treat something else, another stimuli. And contrary to that, in a psychologist perspective, it is going to be internal stimuli as opposed to external stimuli that is going to affect their behavior, feelings, emotions, and how they are treating stimuli. A question that would spark the interest of a sociologist would be why do a majority of men partake in extramarital affairs? And a sociologist would answer this by saying that external culture and how that is being brought down and taught through consecutive generations is that the traditional Chinese aphorisms enable men and put men in a power position to always have the final say in arguments and really in any important difficult question or issue that's going on in the household. And with this power, men often take advantage of this and take advantage of their partner simply because there isn't much that their partner can do about it. And even if the woman does try to speak out, reach out, or get help, they're likely not going to be taken seriously. So this is just the external way that the Chinese culture functions that really sparks men or enables them to treat their counterparts this way. Contrary to this, a question for a psychologist would be, why does frequent quarreling lead to intimate partner violence? And a psychologist would answer this by saying that mental illnesses or disorders such as anxiety and depression are all precursors to unhappiness, which is often accompanied with the onset of an argument. So this, in other words, is saying that as someone engages in frequent arguments or fights, they are often not just doing this because they want to. There is more likely some underlying mental issue or disorder or other issue that is going on that is sparking these arguments, these unhappiness, which often is present during an argument. To continue, I found another second study in relation to the first study that is titled Experiences of Intimate Partner Violence During the Lockdown of the COVID-19 Pandemic by Lyons and Brewer, and this is found in the Journal of Family Violence, published in February of 2021. Basically, the findings of the study is that factors such as poverty, social isolation, unavailability of healthcare services, and coercive control were all found to be significant precursors to intimate partner violence. So basically, people that were laid off during COVID, people that were forced to quarantine, people that could not afford healthcare services were more likely to bicker and to be subject to coercive control, as they were just basically squished, and forced right in a household with their significant other. And this ultimately led to increased rates of intimate partner violence. And so together, these two studies help understand which risk factors set couples at a higher risk for experiencing or partaking in intimate partner violence, and as well as how social conditions, or in this case, natural disasters, can increase the likelihood of intimate partner violence occurring in a household. Here are my references. This concludes my presentation. Thank you all for listening.